Heart disease. It remains the leading cause of death for men and women in the United States, which is exactly why Heart Health Month serves as a crucial reminder to take good care of your heart. So joining us to talk about it this morning is Dr. Nader Makki from St. Joe's Hospital and Medical Center. Dr. Makki, good morning to you. We've been having a great conversation leading up to this interview. Let's first talk about the signs of heart attack, because it's not always what we see in the movie, somebody clutching their chest. And it can be different for men and women, right?
Absolutely. I mean, that's a very good point. I mean, men have more the classic signs of heart attack. Like we were discussing earlier, the things you see in the movies, right? You know, pressure on my chest, I have jaw pain, I'm feeling my left arm going numb. That's more the classic signs, which almost always are recognized by everyone.
Okay.
In women, it's actually much more challenging because it can be a spectrum of symptoms. And more often than not, it's not actually chest pain. It's more shortness of breath. Or the classic story, I can't breathe, or every time I lay down, I feel like I'm suffocating.
Interesting.
And more often than not, they also have like nausea. They feel like it's like an acid reflux kind of symptoms. So the story we hear often is, you know, I've been feeling my stomach is upset. I took multiple Tums and I'm not feeling any improvement, so I came to the ER. And then they do the EKG, and then it does actually show a heart attack. So it can go missed, because it can be a confusing symptom.
I bet. Let's take some steps backwards. Long before we ever get to the heart attack, let's talk about heart disease. Talk to me about the importance of diet and exercise and what we should be doing in those two categories.
Absolutely. I mean, I think prevention is key. That really goes a long way to preventing a heart attack from happening and preventing all this cascade of events that can happen. The diet and exercise are all going to be the cornerstone of any kind of prevention plan. Because what we do from a cardiology standpoint, whether it be medications, procedures, we're not treating the root of the problem. We're trying to make you feel better, trying to avoid the heart attack, but it all goes down to prevention to make sure this doesn't happen again.
Sure.
So diet, there's a lot of diets out there, and it can be overwhelming. You know?
Sure.
So every time you go on social media, you hear about the new diet trend, and it's a lot to take in. But the question is, what's the most beneficial diet from a heart standpoint? It really comes down to two.
Okay.
One is the Mediterranean diet.
Sure,
it's been proven time and time again. Okay. It's a diet that patients like because you have a lot of variety in it. You can customize it to what you like and don't like. And at the same time, there's a lot of studies that have shown it's really beneficial in lowering your cholesterol, and making sure you don't have any heart attacks in the future. And the second diet, which is harder to do, is the plant-based diet. So plant-based diet actually has been extremely beneficial, but it is actually harder to do because it requires a more strict commitment.
Sure.
So a lot of patients may not be a fan of it or find it hard to do it long-term.
Dr. Makki, let's talk about exercise. Sure. To what degree should we be exercising? And it's not running 10 miles every day, right?
No, absolutely not. I mean, the key point here is to give yourself enough exercise to elevate your heart rate for a period of 30 minutes a day, 5 days a week.
Okay.
We're also trying to be practical and pragmatic. You know, we all lead very busy lives. You have family responsibilities, you have work responsibilities. So we understand the time constraints. So the recommendation usually is 4 to 5 times a week. Okay. You want to do what we call 30 minutes of vigorous exercise.
Got it.
That could be walking fast, that could be gentle jogging, could be swimming, depending what you like or enjoy.
Got it. Heart disease itself, what are the common signs, and when should I start worrying? When should I go see a doctor and say, I need to address this?
Very good question. I mean, there's a distinction to be made between heart disease and the heart attack, right?
Got it, right.
Heart attack is the emergency situation which we talked about. Heart disease is more of a slow brewing process, and it can take years before it causes a heart attack. So it can really creep up on people without realizing. The main symptoms to be aware of, to know, like, should I get checked out? Or should I be worried? One, symptoms. So the symptoms of heart disease, sometimes it could be chest pain when you're walking. You say, you know what, if I'm sitting down, I feel fine. But if I'm going on my usual 1-mile hike, I feel like my chest is bothering me, or I feel like I'm short of breath.
Okay.
The other symptom we see a lot is fatigue, or feel like my stamina is just not what it used to be 6 months ago.
Yeah.
And a lot of people tend to blame it, oh, you know, I've been busy, or I'm getting older, which I understand, but more often than not, it's actually like an early sign that you may be having heart disease.
Interesting. Dr. Nader Makki, thank you for the important conversation. I know that you do important work at St. Joe's Hospital and Medical Center, so thank you so much, and wishing you good health, my friend.
Thank you so much. Appreciate your time. Thank you again. Appreciate it.